One Child by Tori Hayden. One Child is an excellent book because the writer Tori Hayden is a young teacher who teaches children that suffer from autism, mental retardation, schizophrenia, and other behavioral problems. In the beginning of the book, it talks about how Tori is reading the newspaper and reads about a 6-year-old named Sheila. Sheila kidnapped a 3-year-old and caught him on fire. Luckily, the 3-year-old survived, and he was just severely harmed. However, Sheila went to court, and they decided that she should be put into a state hospital. However, no room in the state hospital was available, so they decided that she should attend Tori's class until a room was available for her. Autistic spectrum disorder is also known as autism. Autism is a developmental disorder that some people are born with. It's not something that you can catch or give it to somebody else. Autism affects the brain and makes communicating and interacting with other people complicated. As many as 1 out of 110 people every day have autism. Autism is more common in boys than it is in girls. And usually you can tell if someone's autistic from their time they're born all the way up until they're 3 years old. You could tell before then, but that's usually when you'd be able to tell. According to the DSM, autism is a qualitative impairment in social interaction and in communication. People that have autism also seem to have stereotyped patterns of behavior, interest, and activities. The DSM also says that someone who's autistic may have a linguistic disability. Not to mention, those who are autistic seem to be repetitive in where they repeat things over and over, whether it's from a day, a week, a month, or a year. They just repeat things over and over. Also, they may be restricted in their speaking, which is when you would tell, like a toddler when they're supposed to speak, they may not speak right away. Just like a baby, you'd be able to tell if a baby was autistic because when you're talking to them, they don't really look at you or show any significance that you're like there or that you even exist. Asperger's syndrome is an autistic spectrum disorder. However, it differs from other autistic spectrum disorders from its preservation of linguistic and cognitive development. Although it's not required for diagnosis, physical clumsiness and a typical use of language are frequently reported with those who have Asperger's syndrome. Teens with autism might not act like other people or like others that have autism because their brain processes information differently. Sometimes people with autism have trouble talking and communicating, that they might communicate with gestures instead of words. Also, sometimes people with autism have difficulty making eye contact or understanding social cues like smiling or frowning. It can be hard for kids who have autism to make friends and interact like everyone else, that they might spend time alone and show less interest in making friends. Others might look for company and friendship, but it is very hard for someone who has autism because they can become frustrated and upsetting, especially if it's directed at you. But they don't mean to be offensive. It's part of their disorder. Because they can't communicate emotions like other people and interact the same way, they can have a very hard life. They might express themselves more inappropriate than most people because they're not used to showing emotion. But that's not true. But that's not entirely true because they can feel emotions. It's just not the same way as how we do that don't have autism. They can be sensitive to sensation, and they may draw back whenever someone tries to hug them, or they may get startled at a sudden noise, even if it's not very loud. Many people with autism have difficulty coping with change and get anxious if their daily routine is messed up. In more severe cases, they may fixate on different objects or ideas or display repetitive motions, like they may rock, flap their hands. Some people with autism have intellectual limitations and learning problems. Others are highly intelligent. They may have a high IQ and do exceedingly well in work, but they usually have a hard time communicating it. Sheila showed some of these examples. Like, she had a high IQ. She did excellent on her math work. That the school psychologist did tests on her because they thought she did so well. Also, she had a behavior problem where she would try to hurt herself. She would bang her head against the wall or on the table when Tori tried to get her to do something. She refused to participate in activities that the other children were doing. Every time they tried to get her to write on paper or do her math problem, she would wad it up and throw it away. Whenever Tori went to lunch, she climbed up on a table and took a pencil and poked all the goldfish's eyes out and just threw them on the floor. Also, she refused to talk at first, but then she had repetitiveness too, where she would mention over and over how her mother had took her 3-year-old brother and left her in the middle of the highway, that her mother didn't care for her. She would repeat it over and over. And Tori gave her a book called The Little Prince, and she would carry it around with her everywhere and would always repeat certain parts of the book over and over. She would also carry her little hair clips around that Tori had given her to wear in her hair. She was a good student at reading, though. She was really good at reading and writing and her math. She was pretty good in her schoolwork because she did real well. She just didn't want to participate, and she wasn't really interested in interacting with the rest of the children. But Tori helped her overcome that, where she participated a little more and did a little better. However, every time she would do a math problem, they were only required to miss like 5 and then they'd stop, and she would do better than that. Sheila would only miss maybe 1 or 2 problems, and she thought she did horrible, and she would just rip the paper up. She tried to be a perfectionist in her math work. Although most people believe that children that are born with autism is a horrible thing, I believe that it's sad because they do not communicate and interact the same way that the others do. However, I believe that because they don't, they focus on other things that makes them gifted, like whether it's building, math work, reading, writing. I believe that although it's sad that they are autistic, there are some advantages of it because they see the world differently than we do. Doctors know exactly what the cause of autism is. Experts think it's probably a complex combination of genetic and environmental factors. Families who have a child that is born with autism are at a higher risk of having another child that is born autistic also, or else another problem that is similar. Although scientists have not yet pinpointed exactly why some people develop autism, they do know it's not caused by things like vaccines or bad parenting. Although autism is treatable, there's still much research that needs to be done because there is still no exact cure, and the treatment does not cure all of the symptoms and development of autism. It's usually best for kids to be treated whenever they're very young or whenever they're first diagnosed as being autistic. Because autism shows up differently in different people, treatment varies from child to child. The same specialists who help diagnose a child usually work together in order to come up with the best treatment. A treatment program may include speech therapy, physical therapy, combination of other therapies such as occupational therapy, behavior therapy, social skills training, music therapy, and medication. By the time they're teens, people with autism might take regular classes or attend schools that are available to help them more. Should be like a special class, and it could be at high school level. Some may go to a special school because of their behavior in general, because some have very bad behaviors that they can't be around other children. Since each case of autism is unique, and autism includes many different levels of impairment, a prognosis is hard to predict at any autism diagnosis. However, certain factors influence an autism prognosis. Some doctors will not give a parent a definite answer about their child being autistic and if it's a long-term future. Part of the reason is that it is always hard to predict the future capabilities of any toddler with certainty. Doctors are also careful not to mislead parents because the child is still developing and intervention can make things much difficult in the child's future. Factors that can affect the prognosis for autism include IQ, language development, communication ability, social skills, and general level of impairment. You can help your autistic child through early intervention and find the right treatment plan. Autism treatments may include a mixture of therapies, behavior modification, medication, and diet changes. Finding the right treatment for your child may take some research, and working closely with your child's doctors and therapists could also help. Ongoing autism researchers are constantly looking for the more effective autism treatments. Potential autism causes and potential cures are also being looked for by them. Although they don't know the exact cure of autism, and research doesn't reveal any possible answers of more insight of what could be the cure, they're still looking, and they are on a mission to figure out the cure of it. That way they can help those that are autistic and help them to live a better, normal life. You can help a child who suffers from autism make the most of their life by just being their advocate, which basically means being there for them for their specific needs, researching autism, and seeking treatment. Also, you can help talk to their doctors and therapists, as I mentioned before, which would also be helpful not only for your child, but also for you that are worried about your child. Working closely with all doctors, teachers, and therapists on the treatment plan helps make sure that you agree with the treatment that they are planning on having with your child. If a doctor or therapist ever gives you a dire prognosis, do not give up hope. Seek second opinions and keep looking for the right treatment plan. Remember, there's always hope and room for improvements. Even in severe cases of autism, the right treatment plan can provide some level of symptom improvement. That is why I believe someone that has autism can live a normal life, or at least a close to normal life, as long as someone's there willing to help them. It's sad that they always need someone to help them, but as long as you're willing to help them, then it can help them better for their future and for their own confidence. Just like Sheila had Tori help her, but in the end, Sheila understood and a little bit better, and she improved a lot. She quit throwing tantrums, she quit acting out, she gave life a chance instead of just throwing it away. Not that she meant to, it's part of her disorder, but she gave life a better chance. And I believe children with autism do deserve a chance.